This FedGov Today program is sponsored by Accenture Federal Services. On this edition of FedGov Today with Francis Rose, more tools in the toolbox to defend against healthcare cyber attacks, the data fuel for the next generation of health surveillance, and excitement and fear over artificial intelligence. Welcome to FedGov Today with Francis Rose. The Cybersecurity and Infrastructure Security Agency's debuting a new cyber toolkit it created with the Department of Health and Human Services. CISA says that toolkit is tailored for the healthcare sector. Nitin Natarajan is Deputy Director of CISA. Nitin, welcome. It's great to talk to you. How are the cyber challenges different, if at all, for the healthcare sector as compared to the rest of the economy?
I think one of the biggest challenges the healthcare sector has is that it's an issue of patient safety. At the end of the day, the potential vulnerabilities in a hospital or in all the ancillary services that are required to execute healthcare become a patient safety issue. And I think that's what really sets it apart from a lot of the challenges other sectors are facing as well. When
you rolled this toolkit out a week or so ago, you talked about all the different components here. You talked about PII, which seems obvious, financial information, health records, countless medical devices. How does this toolkit that you're debuting help organizations protect that kind of information?
We really wanted to make sure that healthcare institutions across the nation, both urban and rural, small and large, had access to services and resources that to help them build their cyber resilience across the nation. And I think one of the challenges we've had is that a lot of organizations are used to working with just my organization at CISA, or they're used to working with HHS, or they're used to working with private sector colleagues. And what we really wanted to create is that one-stop shop that folks can come into and understand the services not only provided by their partners they're used to dealing with, but frankly all the organizations that are coming together to help healthcare across this nation. And this toolkit allows them to do that. So it's that opportunity now to understand what already exists that they could tap into, but also gives us that location for future products to go into a centralized location to make it easier for our partners to access all of our joint services.
All right, let's lift the lid on this toolkit. Your press release says this toolkit consolidates resources like CISA's cyber hygiene services, HHS's health industry cybersecurity practices, and HHS and the Health Sector Coordinating Council's HPH Sector Cybersecurity Framework Implementation Guide. The long title. What does all of that mean? Who uses that, and who would you like to use it that maybe isn't today?
So we love healthcare organizations across the nation to tap into the toolkit, and what we have found is that different organizations, based on size, based on prior investment and efforts, those that have been a victim in the past and those who have yet to become a victim, are able to tap into different levels of the organization. So we have some that have very robust programs that need a different level of service and a different level of support. So we wanted to make sure we had tools and resources at more an advanced level to help them. But we also know there's a lot of concerns and challenges in rural healthcare. Small hospitals that just don't have the staffing and the resources to do this. Those entities that we consider target rich and resource poor, how are we able to make sure that they have access to free services and scalable capabilities that they can tap into without a lot of lift? And this is what that toolkit allows. It allows all those types of organizations to tap into that and really help build that resilience from a preparedness perspective. But we also really want to build relationships. At the end of the day, CISA is an organization of partnerships, and we want to build relationships with organizations in their communities. We have over 700 employees throughout the country in communities across America, 50 states, and Puerto Rico and Guam as well, that have expertise in physical security and cybersecurity. And we want to help these organizations build the resilience against physical security challenges and cybersecurity challenges, utilizing experts in their community. And then in the event that there is an incident, that we're there to help an organization get through it.
The way that you described the landscape, I think, helped me really understand it. And it seems like there's an analog to what happened in the defense industrial base maybe 5 years ago as the departments, the individual services and DoD broadly hardened their cyber defenses, as the major contractors hardened their defenses. The threat went further and further down in the DIB, and it sounds like that's the challenge that you're seeing in the healthcare sector too. Is that a fair read on my part?
It is. I think, as we look at the supply chain, as we look at the vulnerabilities across the board, and we're also seeing a change in the adversary landscape, right? I think as we looked predominantly years ago at Russia, China, Iran, North Korea, we're seeing cyber terrorist organizations, cyber criminal organizations standing up. We're seeing ransomware as a service, which makes it easier for somebody to get into the cyber criminal activity. We're also seeing a change in the landscape on the victim side as well. And if we look at healthcare, for instance, there always used to be a premise, even in kinetic warfare going back centuries, you never impacted healthcare. right? You never touched a hospital, you never touched a a tent with the Red Cross on it. We're not seeing that same challenge today. We're seeing cyber actors going after healthcare facilities across the nation and across the globe. So really making sure the healthcare sector understands that they are a potential victim, that we're seeing these types of events across the nation, arming them with the data and information tools and resources so that they can take steps to build resilience. And it is, again, not just the large hospitals, but really everybody involved in that healthcare ecosystem, because your hospital may remain intact, but frankly, if your suppliers aren't able to provide you medical supplies, you're going to be impacted.
Recently, about ransomware, you said CISA has, just in 2023, conducted pre-ransomware notifications to over 65 U.S. healthcare organizations to stop ransomware encryption and warn entities of early-stage ransomware activities. That sounds like a bad thing on the surface, but it sounds like there's a silver lining there, that you're able now to get ahead of this, where I think for a long time people were not able to get ahead of ransomware attacks. Am I reading something that's not there, or am I reading accurately between the lines?
No, that's exactly it. I think we really are now able to go to organizations based on information we're gleaming around the globe and working with international partners and researchers and other partners to say, we know an adversary is on your network, and the potential for you to be locked up for ransomware is there, and we want to help you mitigate against that. We've done over 800 notifications this year alone, so it's an effort we kicked off earlier this year, and we're just amazed at the volume of these notifications that we're allowed to do. But I think this is really a game changer for us, because we're not just coming in after the fact, but we're able to prevent these from happening, including at over dozens and dozens of healthcare facilities across the country, where again could lead to potential patient safety issues. To be able to prevent that, I truly believe, is a game changer.
Take me back to the beginning of something like this toolkit. You can use it specifically if you like, but these collaborative efforts, as you described CISA's role earlier, I imagine it's pertinent to all of them. How do you identify the stakeholders that you want to be involved in putting together something like this? In this case, HHS seems obvious, but how do you identify who else you want it to be at the table in order to get the result that you want?
Sure. So the beauty is we've had a construct in place for over 15 years. So we've identified in critical infrastructure 16 sectors. Each of those sectors has what we call a sector risk management agency, and HHS is the sector risk management agency for healthcare. And those groups already have within them both committees, one on the public sector side, one on the private sector side. So we've actually have over a decade of experience in collaborating with private sector partners in a formal relationship and structure. So it was really easy when we wanted to engage on the toolkit to really take our collaboration to the next level, to bring these existing partners together who are already working with industry in different ways, working with us in different ways, and really to help consolidate that. But more importantly, I think, than consolidating what we have is making that commitment to a joint effort going forward, that we are going to collaborate and work together, public and private sector, HHS and CISA, for all of these activities as we come forward. And it's evidenced, I think if folks look in the toolkit, a lot of our documents are joint sealed now, and not just joint sealed between HHS and CISA, but frankly with the private sector as well, and with partners all over the globe. We've recently put out guidance that 16 other countries signed on to. And so we're really trying to make sure that we are living the partnership, and we're demonstrating that partnership. Because at the end of the day, when it comes to talking with the healthcare community, HHS is, has the trusted voice. We bring a lot of expertise from the cyber perspective, but CISA is not full of hundreds and thousands of healthcare specialists, so it really is that partnership and teamwork. And frankly, the private sector making sure that what we're doing is helpful and useful, and that's why I think having their sign-on as well is so critical. Building these partnerships, of course, is important. Maintaining them, nurturing them, I imagine, is equally or maybe more important. How do you go about doing that at CISA? What are the factors for success that you've seen? So we are looking at how do we look at quantitative metrics, and I think to me the issue isn't just sharing information. The issue is how are we changing behavior? How are we driving actions to take place that are truly raising resilience? So we're actually following up with organizations after we share mitigation guidance, 6 months, 12 months. What have you actually implemented? What changes have you made to physical security, to cybersecurity? And to us, that's where we're making the biggest difference, and we're seeing a positive impact. We're seeing a lot of great feedback on the tools that we're able to provide, but most importantly, we're also getting feedback on where we need to direct our efforts as we go forward. We want to make sure that what we continue to focus on in the future is truly has an end place in industry and can be be utilized. So that feedback's also been critical to our future success.
About 30 seconds left. Is that the way that you measure success, is determining whether those factors that you just laid out, whether you and the organizations you partner with meet them?
Definitely. I think it's about making sure that the actions are being implemented and that we're collectively raising resilience, and that's the measurement.
Nitin, Natarajan, it's great to have you on the program. Thank you for your time today.
Thanks for having me.
You can read more about the toolkit and find a link to it on today's show page at fedgovtoday.com. Up next, the data fuel for the next generation of health surveillance. FedGov Today with Francis Rose continues in a moment.
Don't miss the 7th Annual Appian Government Conference on November 29th in Tysons, Virginia, to learn how you can use low-code and AI process automation to empower your workforce, enhance citizen engagement, and reimagine service delivery. Register now at appiangovernment.com.
Welcome back. The data that Nitin Natarajan just talked about protecting in the healthcare sector will fuel the next generation of health surveillance. 3 steps will drive success in using data for health surveillance for federal agencies, according to Kenyon Crowley, Managing Director of Applied Intelligence for Health at Accenture Federal Services. Kenyon, welcome. Thanks for joining me. You and your co-author, Casey Morris, write about health surveillance. What does that term mean? What's the definition of it, Kenyon? Welcome.
Health surveillance means proactively guarding against threats to one's health. So if you think about communities and individuals, how do we understand what might be threatening their health, either from environmental factors, infectious disease factors, other things that might impact wellness, and then designing strategies to predict that and then intervene to keep the nation healthy.
I imagine that's a concept that became much more prominent during the pandemic, but was not new because of the pandemic. Is that fair?
I think that's very fair. Health preparedness has been around for a long time. I think the pandemic shone a light on areas that it needs to improve to be able to have a sort of more responsive health system, to be able to react faster and get the data that one needs to be able to make decisions during times of pandemics and other health threats.
You and your co-author are writing about 2 main concepts for what you call unleashing the potential of a modern data infrastructure. These are probably relevant not just to organizations building healthcare data infrastructures in the federal government, but to anybody. The first one you write about is using natural language processing to analyze complex unstructured data. What's the intersection there, if any, to artificial intelligence, and how does natural language processing help in that situation?
That's a great question. If you think about developing insights from all the data that exists in our ecosystem, whether that's on social media or in doctors' clinical notes or in other places that we find written language, being able to understand what's in those documents and apply that to decision making is what natural language processing is about, and artificial intelligence provides mechanisms for processing that language. Indeed, a sector of large of natural language processing is large language models, the ChatGPTs and other services that are, all the rage right now. And so figuring out how to apply natural language processing and large language models to get those insights, to summarize data, to generate insights about data is an exciting area putting a lot of focus on right now.
You and Casey write, the performance of natural language processing has improved significantly through what's known as transfer learning. What does this process look like today? What does that improvement look like? And what do you expect the trajectory of that improvement to look like over time?
Well, indeed, I think if you look at the modern data analytics pipelines, being able to not only get information from these analytical engines, but being able to feed information back to them. So if I'm an analyst, a health analyst per se, and I receive information from a report, but I say, hey, from my own human perspective, it's not quite right, or we could add additional context to that data that can improve the downstream decision making the next time the model sees the same data or similar data. That's an important concept in transfer learning.
The second piece that you and Casey are writing about is large-scale modeling. You referenced it already, for robust scenario-based insight. What's a scenario-based insight?
So if you imagine a scenario, so imagine an unknown pathogen appears to be growing on the eastern coast of the United States. So there could be a variety of scenarios that may be driving that, and there are a variety of scenarios that one may apply as a public health professional to be able to respond to that. So using AI and scenario planning and generative AI, we can model a variety of scenarios and look at the trade-offs of those scenarios in terms of health outcomes, economic outcomes, the likelihood that they may work with different subpopulations that may exist in these different areas. So it serves as a sort of more advanced planning tool one can use used to optimize outcomes.
What are the nuts and bolts that an organization, a federal agency in particular, should be thinking about, the technological stuff, the underpinnings of building an infrastructure like this?
Yeah, so federal agencies and federal health agencies, where I spend a lot of my time, need to think about what's the quality of the data, what's the efficiency of those data pipelines, and is the infrastructure that we're building, is it resilient, is it adaptable, and can it work with the data to deliver insights? One of the architectures that we're seeing be very fruitful in this regard is data mesh. So in a data mesh, instead of having all your data brought together in one centralized place and trying to manage that as a large mass of data, being able to have a federated network of different data products and different nodes in that network, but then building a really intelligent orchestration layer, a privacy-preserving layer across that data to allow it to be combined and used without all the overhead that it would take to bring it into a centralized fashion. And if you think about what are some of the other nuts and bolts around that, it's having a master data catalog, it's implementing methods so the data is findable, it's accessible, it's interoperable, and then reusable. And there's a number of strategies one can apply to do that.
Kenyon, it's great to have you on the program. Thanks very much for your time today.
I really enjoyed speaking with you, Francis. Thank you.
You can find a link to the piece Kenyon co-wrote with Casey Morris about health surveillance on today's show page at fedgovtoday.com. Up next, excitement and fear over artificial intelligence. FedGov Today with Francis Rose continues in a moment. Here's Joe Boy, system engineer at Palo Alto Networks, from AI in Depth.
Imagine you sitting behind a keyboard, freshly new into the space, and you have a co-pilot that helps guide you through the process of ensuring your environment is secure, setting up the right policies to make sure that what you do set up is going to be effective, and getting those recommendations from the AI to say, hey, this is where we think you should best put your tools and resources to get the best out of it, right? And so that's one way in which we see it being a force multiplier.
To watch the whole program, go to fedgovtoday.com/AI. Welcome back. Artificial intelligence will generate, quote, tremendous excitement and tremendous fear in the healthcare realm. Generative AI in particular is driving that excitement and fear. Micky Tripathi is National Coordinator for Health IT at the Department of Health and Human Services. Micky, welcome. It's great to see you. You made that comment about excitement and fear at Vive 2023 in Nashville in March. What do you mean by that?
Yeah, I think the excitement part is there's a tremendous opportunity, I think, that all of us are going to benefit from the appropriate and responsible use of artificial intelligence in healthcare. The fear part is that there's a lot of unknowns right now. It's a very, very powerful set of tools, and we need to know how those are being used, and that we're able to use those in a responsible manner to be able to do good and to make sure that the downside of it doesn't, sort of offset the upside. You
made another comment there that I thought was really insightful and really interesting. You talked about the fact that this was at a point in time, as I said, in March, right, when people were just really starting to understand what generative AI could do. It was becoming mainstream at that point.
Yep.
And you said, we're all just learning about this, and yet, I think you said something along the lines of, at dinner last night, I heard 10 ideas for using generative AI that I never thought of before.
Right.
What's the potential that you see just on the landscape, not about specific applications or anything, regarding generative AI in the healthcare space?
Sure. There's just a whole spectrum of opportunities here you can think about. One is just on the administrative side, which is, as we all know, our healthcare system has a lot of paperwork and has a lot of processes, and even the applications that are going on right now are really about saying, how do we reduce the burden on the healthcare delivery system, clinicians, nursing staff, others, so that they can actually spend more time delivering healthcare and talking to patients. So that's a huge part of the applications that feel kind of boring, but they actually could have tremendous opportunity for us. And then when you think about the novel ways that it could be used in actually a clinical context, having a better ability to identify diseases, identify different pathogens, be able to, screen through in very fast manner, images, things like that, and be able to be much more accurate in identifying things that might pop up in images that are harder for a human being to be able to, to see with accuracy and with consistency. And those are the kinds of opportunities I think that it harkens for us.
What are the potential drawbacks that you see that people can watch for to help mitigate the fear that you referenced?
Yeah, and that, part of that fear was more of a, not saying to individuals you should fear this, but it was really just almost a caution to us as in the healthcare industry to say we should be appropriately guarded about just turning these loose. And I think, I will say that I think the industry is not doing that, but we've already had examples actually of different types of AI-based tools being used in settings where people didn't really fully appreciate that there could be unintended consequences of them. For example, using a tool that was trained with one population or in one area, and then having it being used with a very different patient population, and it turns out to not perform nearly as well. And so people don't have the confidence in it. There are also a lot of unintended consequences that have been shown from a health equity perspective, for example, in things that might seem like trivial administrative manners, like the way you schedule patients, for example, that have shown to have unintended consequences that end up having disproportionate impact on those who already are struggling with access to the healthcare system. So I think it's really about saying, how do we provide more information to the individuals who are on the front lines, so that you take away that black box nature of it, so that they have a better understanding of what's the appropriate use of this. And clinicians make these decisions all the time with medications, with with treatment, with devices. So this is really just saying, give them the information they need to make better decisions.
What you're saying sounds remarkably similar to what some officials I talked to at the Department of Veterans Affairs in a podcast series that I did a month or so ago about using artificial intelligence in the VHA. One of the things that they emphasized was how we convey to the patient what's behind the screen, so that they understand that they can trust it the same level that the providers that are using it to trust it. Does that sound like the discussion that's happening in the private sector too?
Yeah, I mean, I think it's sort of multi-layered. One is, let's make sure that the providers, first and foremost, have that information so that they themselves have a better understanding, so it's not a black box to them. And then having them have that appropriate discussion with the patient so that the patient has a full understanding. And already, you're already seeing some of the early pilots that people are doing where they, for example, with responding to inbox messages. All of us are on our patient portals and sending lots of messages to our providers who are getting 80 of these a day and trying to deal with them in their pajama time, as they call it, at night. And so they're starting to use tools that allow an automated response that a physician reviews before releasing it, but it saves the time. And they're putting in the bottom, this was generated by AI and reviewed by a clinician, for example. So I think there are lots of different ways you can engage the patient, make the patient aware of what's of these tools being used, that gives them comfort that it's actually for their benefit.
We've talked on this program, many other programs, about the importance of data and how it underpins whatever artificial intelligence delivers for clinicians or whoever the end user is. What's your sense of the current state of interoperability among that data that's being exchanged among federal agencies, the private sector, state, local, tribal organizations, and many others?
Yep. Yeah, I mean, the current state of interoperability, I would say, is good and bad, and in perhaps in surprising ways, for people. So the good part is that, we've spent over a decade now investing in electronic health records across the country, and we've really turned around the industry from one that was really paper-based to one that is, 97% of hospitals and almost 80% of ambulatory practices across the country are actually using a certified electronic medical record system from my office. So we've kind of flipped it from a paper-based system to one that is very digital now. And people, I think, experience that sometimes in negative ways where they feel like, oh, the doctor's looking at the screen all the time. On the other hand, you have access to your information through patient portal and through your apps and on mobile devices that I think is a real benefit to patients. There's also a lot of information that's actually being exchanged behind the scenes from provider to provider. So increasingly, when you show up at the specialist office, for example, they actually have your record. And that happened behind the scenes in the way that the banking system, makes sure that when you take something out of the ATM or you use Venmo or whatever, it actually gets reconciled. You don't have to worry about it. It's like, they're going to reconcile it. The bad part of interoperability, I would say, is the experience that too many of us have in our direct engagement with the healthcare system, where you still, all too often, go to the provider and you're going to another provider, let's say, and they hand you a paper record and say, here, bring this to the other place. And you're like, God, we have electronic systems that can do this. So we still haven't solved that last inch, that we've got a lot of systems that actually are connected, but they still haven't done the full implementation all the way to the frontline staff who are still have the instinct of saying, well, I'm still going to print it out, or I'm still going to fax it, or I'm going to hand you a CD rather than sending something electronically, which I think undermines people's confidence and sense that, is this a modern system or not? Because Home Depot and Amazon are doing things that my healthcare delivery system isn't doing for me.
What are the steps that would ameliorate the bad and accentuate the good that you just described?
Yeah, those are already underway. So the 21st Century Cures Act in 2016 laid out a number of things that that my office is now implementing. So one is, and people are hopefully experiencing this today, one is the requirement to move the healthcare industry to the kinds of technologies that we're all used to in our day-to-day lives. So you download apps on your phone. That's like RESTful APIs in the background that are doing that. You don't need to worry about the technical details of what that is, but it allows you to just have that experience of, I downloaded an app, the New York Times app, or the Washington Post app, or the FedGov Today app, and I'm able to use that really easily and quickly. So that already is now in place. So all electronic health record vendors have to make that available. So you as a patient can take the app of your choice, download your records, and have those available to you. We also are creating a nationwide network that's we call TEFCA. That was, again, with direction from the 21st Century Cures Act, that it was going to create that medical internet that all of us wanted. So those records are exchanged without your having to worry about it, and offers the ability for you to just go to one place to get all of your records if that's what you as an individual want to be able to do. The last thing is, it did put into law a requirement that organizations stop what they called information blocking. So the idea was that we set up these systems to interoperate, but we've still got a very competitive healthcare delivery system, right? It's a private sector system, in many ways, and you still have competitive organizations who may not want to share information with their competitor across town because they're afraid they're going to lose the patient, and so there's still too much, of that information not flowing. 21st Century Cures Act gave the direction that information blocking is no longer allowed. We're putting that policy into place now.
Micky, it's great to talk to you. Thanks very much for joining me today.
You too.
Appreciate your time.
Really enjoyed it.
You can read more about technology and healthcare and what HHS is working on today's show page at fedgovtoday.com. FedGov Today continues in just a moment. Mark your calendar for December 14th. AFCEA DC invites you to the 47th Annual Winter Gala at the National Building Museum. Join leaders from defense, federal IT, and industry for an unforgettable evening of elegance and goodwill. Last year, AFCEA DC raised more than $190,000 for scholarships and collected thousands of toys, and they want to top that this year. Reserve your tickets now. Visit dc.afceachapters.org for details or go to fedgovtoday.com/events. Welcome back. In today's event spotlight, Appian Government is coming November 29th at Capital One Hall in Tysons. You'll learn how to achieve superior outcomes when you combine the right people, processes, and advanced technologies. Speakers from DoD, civilian agencies, and industry will help you empower your workforce, enhance citizen engagement, and reimagine service delivery to advance your agency's mission. You can read more and register at appiangovernment.com. FedGov Today TV returns next Sunday morning at 10:30 with the head of the Hosting and Compute Center at DISA, Sharon Woods, and Guy Cavallo, the CIO at the Office of Personnel Management. I'm Francis Rose. I'll see you next Sunday. Thanks very much for watching. Have a great week.
Don't miss the 7th Annual Appian Government Conference on November 29th in Tysons, Virginia, to learn how you can use low-code and AI process automation to empower your workforce, enhance citizen engagement, and reimagine service delivery. Register now at appiangovernment.com.